Welcome to the Neural Implant Podcast, where we talk with the people behind the current events and breakthroughs in brain implants in an understandable way, helping bring together various fields involved in neuroprosthetics. Here is your host, Giovanni Lauricella.
Hello, everyone. Welcome to the Neural Implant Podcast. Today's guest is Giovanni Lauricella of the Mullings Group. And he and I have actually become pretty good friends over the last year. And he's a medtech recruiter, which basically means if you want a job in the medical device field, he's a good person to talk to. And also, if you're a company and you're trying to hire somebody very talented, he's a good person to talk to. So Giovanni, pleasure to have you on the show finally. Sometimes it's really crazy. There's some guests that I meet on the show, and then there's other ones that I've known for years, and then just finally it's, wait, you've never been on the show. You need to come on the show. So welcome.
Thank you very much. Yeah, as soon as you offered it, I couldn't wait to jump on. So thank you for having me.
Excellent. I described you a little bit, what you do, but do you want to explain it a little bit better, what you do?
As succinctly as I can. So we are focused in medtech startups. That's our main focal point. We don't deviate from that. So we don't work with the big guys, Medtronics, Strykers, all those kind of big companies, which keeps us in this entrepreneurial ecosystem, working with investors who invest in these startups, building out the startup teams themselves. And so our firm, 40 plus, partners are PhDs, engineers, MDs, my master's in regulatory affairs. So we're technically focused. I've been with the firm for a little over 10 years at this point, wild and crazy to say. The firm as a whole is 30 years old. They hired me to bring us outside the United States initially, so put us in about 30 countries within the first 18 months. And this was back in the day when, previous to European medical device regulations, the EU MDRs coming into effect, where all the companies as startups would want to look for CE mark first. Building out our US startup relationships, bringing them over to Europe, then that networking effect took us to Israel, to China, to Australia, to Japan. The running joke at this point is the only place we haven't built a medtech startup team is in Antarctica. And actually, quick funny story, I've made 3 distinct phone calls to CEOs who I was working with who actually were in Antarctica, different times, watching penguins with their wives or on cruises or something like that. So we're truly a global firm at this point. What we do focus on is working with VCs who will hire us for CEOs or change management for their investment portfolio companies, and then obviously working directly with the startups. And our claim to fame is we are a one-stop shop for building medtech startups. There are firms out there who only specialize in CEOs and C-level. There are some that only do director and above. There are some that only do R&D or just clinical, regulatory, or quality. Our purpose is we want to build relationships with startups, and given our technical backgrounds, in addition to our industry focus, we're able to put in CEOs, we're able to work with those CEOs in building out their executive teams. And then to make it simple and clear, we do everything from C-level down to entry level, and everything from very early stage R&D all the way through global commercialization. So truly a one-stop shop for medtech startup companies. And then the last thing is we do have a robust network of investors. And due to that, whether it's being hired for their recruitment efforts or simply just rubbing shoulders with them over the years, we're able to have a value add by sharing our network with our medtech startups who are often in parallel raising capital, and even sometimes raising capital in order to expand their teams, or never stopping raising capital and sometimes building their teams. But either way, whenever there's that cash injection, there usually is some sort of human expansion on the team. And that's where we come in. So keeping that people and money effect very tight knit and focused within our medtech community. So that's what we do.
Yeah, that's amazing. I really appreciate the explanation. I think it's really cool because you see both sides of this, I guess, of the market, where you see the entrepreneurial side, which is an interest of mine, an interest of the show, I focus on the show, but you also see, I guess, the working side, the coming out of academia and being trained in medical technology, or especially neurotechnology, which is a passion of yours, as we had talked about before the show. How do you do it? This is so crazy. This is literally, are you befriending receptionists wherever you go and just being like, one day I might be able to get you a job? Or how are you able to get that talent and be able to consistently get talent?
Good question. Like my opener of my own podcast, when I talk about raising capital, there is no silver bullet. And I think it takes time to learn that. You try to find these processes, these replicable processes, but every search is different. So the tools that we use, first and foremost, 30-year-old firm, we have our own network that we've naturally built over time. So time is everything. When you first start out, nobody. 10 years later, you know a lot more people. So technically, if I don't know who I'm about to recruit with my team, I likely know 3 to 4 people who know that person eventually that I can call up. I will be the first person to tell you that we use LinkedIn, of course, like everything else. We've had a massive exposure of people jumping onto LinkedIn, especially over the past 10 years. And it's been the professional social media outlet. But LinkedIn's not perfect. There are people and professionals of all functional areas that see LinkedIn for the value that it is. And they have these robust LinkedIn profiles that allow us to actually scour and find them easily. And then there's people in the industry and rock stars too. Sometimes rock stars have great profiles. Other times rock stars, you go on there and you don't even know that which company they're at because they haven't updated in 2 years. And so some people don't care about LinkedIn and other people care a lot about LinkedIn, even all these years later after it being founded. So we can't rely on that as a sole source. But however, yes, of course we do that. And we're very active on publishing information on LinkedIn and being active in the community. So natural network, internal CRM that we have built over the past 30 years, LinkedIn, of course. And then the grind work hasn't changed. I remember my very first year, we were doing a clinical specialist that had to be an RN coming out of a cath lab in a hospital. And it was a crossover opportunity, bringing that person into industry, the med tech industry for the first time. I didn't have a CRM for nurses or RNs who were in the cath lab and satiating that function that I was looking for. And this was also 10 years ago when LinkedIn was significantly less robust than it is now. The recruiter license didn't even exist at that point, which is a totally separate platform than everyone else has who's not a recruiter on LinkedIn, which gives you access to a lot more people. So I remember having to, and this was in Boston, I had to put together manual lists. I was writing on yellow pads of all the local hospitals that had cath labs. And I'd have to call and ruse into these hospitals saying I was, I don't know, Bob Tom or Joan Smith or whatever it may be. And then as soon as you said, how many cath lab technicians are in the hospital? Oh, there's 4? Interesting. Okay. And then you hang up on them and then you call back and hopefully someone else picks up. And then you say, yeah, I'm looking for one of the 4 clinical specialists in there. I know, is Rosie John still there? Rosie John doesn't work here. Are you talking about Susie Q? Absolutely. And then you hang up and you call back. Yeah, I have an order for Susie Q. Can I? And then that's when you get and then you have 30 seconds to pitch. Susie Q, I have a great clinical specialist up. That was back in the old days. Now LinkedIn and a lot of other things have made it a lot more open. So recruitment has changed for sure. But once again, not going back for the first time of me saying this on this, but I tell this story quite regularly. And this is still the end of COVID period. The world is starting to open up more. Conferences, fortunately, are coming back on. But before COVID, I used to live on a plane and I was in both coasts of the United States. I live down here in Florida, but I was on both coasts of the United States. I go to Israel, I go to China, Japan, Australia. I flew around the world from point to point in 2 weeks one time for one cardiovascular conference in Paris, stop over in Dubai, neuromodulation, actually INS down in Sydney in 2019, and then had to fly home. So I was constantly on a plane, loved being in front of people, shaking hands, kissing babies, having cocktails, drinking coffee in the morning, whatever it may be. And that was really my LinkedIn. The LinkedIn was really the global platform that I played on, which was building medtech startups anywhere I went. So how do I do it? I have an amazing team, incredibly smart people, significantly amount of networking that has taken place over years and time, good relationship management, always being available. And then obviously you have some digital tools to support you.
Yeah, that's amazing. And yeah, we also met at one of those conferences in Las Vegas, NANS. But yeah, that sounds really crazy. That story of calling up the nurses and everything like this, that's a hustle, man. That really sounds like you really earned whatever fees you were paid for that. Okay, so let's shift a little bit to let's help out our audience. If people are in the neurotech field, they're maybe going to school, either undergrads, masters, PhD, or maybe they've been in for a while, what advice can you give in order to be headhunted by you? What is like the ideal candidate and what can candidates do to be more attractive to you?
Somewhat of a loaded question, right? So are we talking about R&D? Are we talking about clinical? Are we talking about commercialization, right? So I'll talk as generally as I can, and then you can pinpoint questions if you have them. First and foremost, if you're in academia and you want to get into the industry or not, that's the first question you should ask yourself. Being in the neuroscience space, it's a very academic field if it wants to be. And also it's an absolutely rapidly growing industry or industrial field as well. So you do have options to stay on the academic side and pursue research and continue pushing out publications and getting things out there that might be taken off the shelf or IP developed that could be built into a company down the road if they want to license it. So staying in academia is an option, but also going into industry is obviously a strong option as well. So you have to ask yourself that question. And some people want to be the postdoc. Some people want to stay in academia. Some people want to push out research for the rest of their life. And that's awesome. We need that. Then on the industry side, it's the people who are developing, commercializing, and getting it to patients ultimately. So that's the first question I'd have you ask yourself. If it is going into industry and even academia for this particular point, if you want to be headhunted, if you want to be found, it's 2021. And there's options to be found at this point. So make yourself available to be found. Build your LinkedIn profile. Let us find you. There's tools and platforms that exist at this point. That's number one. Number two is be active on LinkedIn. If you want to post, if you want to share good quality content, that also gets yourself out there in addition to just being a keyword searchable profile. So be active if you'd like. And then also at a minimum, build a robust LinkedIn profile so that we can find you. Then thirdly, it would be making sure that you're a professional networker. And I don't want to categorize certain aspects of it because there's introverts and extroverts along the entire functional field of a company. But networking it comes naturally for some people and it doesn't come naturally for others. However, philosophically speaking, you can't do this life alone. So you have to be able to build relationships. And if you're an introverted engineer or the most extroverted salesperson, you have to force yourself to get out there, ask questions, build a network, manage relationships. I think that's a huge opportunity. I mean, yes, being recruited by external recruiters like myself, third parties who may not know you immediately, but hopefully will eventually build a relationship with you. I can tell you, after all my clients who are startups, I don't want to say I'm a last resort, but I'm not necessarily their first resort either. If there's a massive amount of funding that they just raised and they have so many operational milestones and traction that they have to focus on doing, that recruitment is simply another part-time job that they have to focus on, and I have a great relationship and they know that I'll get it done for them very efficiently, I might be their first call and be like, listen, I don't even have time for this. Can you just get this done for me? And they'll pay my fees, and gladly, it works out for everybody. But more often than not, just to demystify this, is that startups will utilize their own resources or try to go at it the cheapest route or the most bootstrap route that they can, which is they'll call all the people they know first. Then they'll ask the people in their company if they know anybody. And then they might do postings on LinkedIn or Indeed or something like that. And then if they have time to go through the hundreds of applicants that they get, maybe they get lucky. If you find a really great recruitment firm, which I will tout us and say, yes, we are a really great recruitment firm. We've focused in the space. There's a difference between a recruitment firm who has an industrial focus or an industry focus versus one that's agnostic and doesn't have that depth in terms of being able to talk the talk. It's like what we hear in our own industry, med tech. Can you speak to a physician or can you not speak to a physician? Can you speak to an engineer or can you not speak to an engineer? It's a language. So if you can't speak to it, you'll quickly find that out. So there's industry agnostic recruiters, there's industry focused recruiters. But anyway, going back to it, we are oftentimes one of the later resorts to hiring for people. And is this opportunity for startups, which is my focal point, to do their own active organic networking. And so if you have an interest in joining the industry long-term, if you have ambitions of joining a startup, if you have ambitions of being a CEO or a founder one day, you have to break that discomfort and you have to love networking. So that would be a huge piece of advice. I'll stop there for now.
Yeah, definitely. No, I think that's really good. And a lot of people don't really look at networking as a good thing. They're a little bit like put off by a, sleazy car salesman or something like this, but really it's not anything unnatural or different than what you would do. And as you were saying, I was thinking like when you go to a conference or something like this, really you only need to make one good connection per day. Like somebody that's, wow, this is really cool. And I really enjoyed talking to this person. And so it's nothing too crazy. And over time, you really accrue a good amount of people. But yes, that's, I think it's really good advice. So just basically build your network and just kind of natural friends in the industry. That's essentially what networking is just making friends. But yeah, so I guess the question was like, when you're looking for somebody, what experience are you looking? Obviously, if you're looking for somebody who's in regulatory and blah, 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 they need to have experience in that. So what can people do or learn or engage in order to build up that repertoire and I don't know, be more desirable to you? Or do you just already have to be a CEO to be recruited for a CEO, be in regulatory to be recruited for regulatory? How do you break into that, I guess?
So that's why I started with it being somewhat of a loaded question. And if we want to go into detail, I'll keep it as general as possible and go through the functional areas relating to neurotech. And once again, these are generalities, right? So in R&D, for neurotech, right? And this is why I say it's a loaded question. Are we talking about class 3 active implantable devices? Are we talking about wearables? Are we talking, so neurotech and possibly even stroke? Are we talking about a stent that goes into a blood vessel in the brain, for example? So there's different styles of neurotech, but let's just assume that you're talking about the hard stuff, which is the class 3 active implantable stuff, like neuromodulation. In engineering, it pays off to understand and have experience in the therapeutic area. Do you know the anatomy of what style of neurotech you'll be involved in? It does pay off. However, in neuromodulation, it's an active implantable device. If you came from cardiac rhythm management, or if you came from a fully active implantable heart or an LVAD, it's still an electromechanical implant, class 3 device, it might not necessarily be neuro. It might come from cardio, for example, and that's transferable. So you can keep that open-ended and an option. Other than that, the likelihood of, especially from a recruitment aspect, right? If you're an engineer and you're pulling from a purely mechanical orthopedic company, the likelihood of you joining a super sexy neurotechnology company that has an active implantable and there's some sort of level of crossover that makes sense, it's unlikely. So you might want to have somewhat of a focus in that area. And also neurotech is one of those clubby style therapies where you're either in neurotech or you're not. And sometimes if you're peripherally close enough, like going back to that cardio example, you could get into the club. But then again, cardio is a club too. Orthopedics a club too. It just depends. But it's very technology specific. So that's R&D. Clinical, you can look at it a couple ways, right? Once again, if you're looking at it from, if I'm hiring somebody to develop a clinical trial for my neurotech device, do I need the implantable experience or the active implantable experience, and then the rest of the technology that they can learn? Because oftentimes when you're developing a clinical trial, part of the factor is you should know the key KOLs involved or the most optimal hospitals or centers to be able to design a clinical trial. Can that be learned? Absolutely. And as long as you might have the transferable skill sets coming from cardio or any other therapy for that matter, and you want to just have that quote unquote class 3 active implantable experience from a clinical affairs perspective, that could be transferable into neurotech. However, if you've already had 1, 2, 3 positions within neurotech on the clinical side, for example, it could be very beneficial that you've already built up your network of KOLs, et cetera. And that's what is really of interest to maybe that next position in neurotech that's recruiting. Regulatory, pretty much the same thing. I think having direct experience in the neurotech space for a regulatory position is a real nice to have. Is it a need to have? No. Recently, having done a head of regulatory affairs for a neurotech company, it was a great benefit to have neurotech experience. However, it wasn't a mandate. Given the fact that they had to run a PMA trial and also deal with the FDA and get a PMA ultimately approved, having PMA experience with an active implantable experience, not necessarily just a class 3 PMA heart valve, for example, but something that's active implantable and PMA, more than enough. Great opportunity. It's, if you had neurotech on top of it, it would just be a cherry on top. So once again, it's an opportunity to get into regulatory for neurotech if you have that transferable skill sets. Manufacturing, I think that's skill set transferable. It doesn't necessarily have to be neuro-focused. And if you can manufacture a product that is a scalable product that looked like something else that might have come from a different therapy, once again, cardiac rhythm management, pacemakers, ICDs, whatever it may be. Once again, I'm generalizing heavily here, but more of a transferable skill set. When you go into sales and marketing, let me break them up. Marketing, it would be beneficial to have that neuro experience, especially coming from that KOL and understanding who the key physicians are, what are the great trade shows to go to, all that stuff, heavily beneficial. Is there a little bit more of a transferable skill set situation? Absolutely. And if you've done really great marketing for another class 3 implantable or something adjacent to that, the answer is it's likely good enough. But that's when you get to, is it preferred? Sure. Sales, that's where it becomes, as you and I have been to the INS shows, the NAN shows, sales, especially if you're a rep, not necessarily when you get to the CCO level, Chief Commercialization Officer, or VP of sales, it could depend at that point if you have transferable skill sets of simply building a team. But when you're in that sales rep, managerial, that type of role, people are buying networks. When you're a sales rep and you're running around the NANG floor and you're bumping into physicians and you're selling to physicians and all that it is, that really great network of who that you're selling the next great neuromodulation device to. If you're going to go into another space, you have to keep in mind of what sales is all about. It's a network. Think about me. I'm a recruiter. My network is medical device. If I picked up tomorrow and left the medical device industry and I went to go recruit in defense or aviation or consumer products, I'd be starting from ground zero. I don't know anybody in those industries. If you pulled yourself out of being a sales rep who was only catering to pain physicians, neurologists, whomever, and all of a sudden you wanted to go join a diabetes startup company and you don't know those physicians, it's starting from ground zero. So it's much more about the network that a startup company in the neurotech space, if they're hiring salespeople, would be buying rather than transferable skill sets of just simply sales. Does it happen? Absolutely. It's because sometimes companies have enough resources that they can give chances to for transferable skill set, highly ambitious people, high potential people who want to start from ground zero and they trust their DNA that they can do that. And that oftentimes it's more larger startups or companies for that matter who have the resources to be able to give that opportunity to. If you're first in or the first 5 sales reps in a company, more often than not, they're buying a network, and then you have to get involved into non-compete situations, which is a totally different story. But I'll stop there because once again, generalizations across the board, but there are more, if the listeners of this can take away something, there are certain positions that are more dependent on the therapy that you're focusing and building your career on than others who might have more transferable skill sets. It simply depends.
Yeah, that's, I think, really good advice. And I really appreciate going through all these detailed summaries of each kind of category. I think it's really, I'm glad you went to it that way. I didn't have to dig for all those. But yeah, so I think, I guess the most important one, what about the receptionist?
It's actually funny that you mentioned it. It wasn't necessarily a receptionist, but it wasn't an executive assistant. So I had a client who I've been building for years in the heart valve space. And I've done technical positions for them, quality positions for them, clinical positions for them. And by technical, those are technical positions I just mentioned, but R&D. They had yet to gain FDA approval. So we were building out their technical teams from R&D, quality, clinical, regulatory, et cetera. And having built the team and having a really strong trust with the executives of the company, one day she calls me up and she says, I don't know if this is in your wheelhouse or not. However, I have to get a new executive assistant because my executive assistant is recently resigned and I have to have somebody support my function. And so I said, listen, search is search. And for all those people out there, it truly is the case. If you want to have a debate about that, I'd love to go live with you on a debate on search is search. If you're good at search and you know how to find things, you know how to find anything. Just some things might take a little bit more time. So while I do focus and while my clientele is only in the medtech space, if you've understood the process of how to find things that you're not readily or that are not readily available in front of you, search is search if you're good at search. And it's helped me both in my personal life as well as my professional life.
I bet you're an expert at finding your keys, huh?
Oh, everything. I'm very organized when it comes to that. I don't lose things too often. Anyway, when it came back to this executive assistant, I said, of course, search is search. I'll be able to find this for you. It's not obviously a technical position. It has nothing to do with med tech, but you want a good human being that's going to support you as an executive assistant or executive assistant, I'm on it. And we found an executive assistant that worked out. So
that's really cool. Yeah, you did touch on earlier that I think is really interesting is kind of when you're in a startup, like you're 4 people in a boat and everybody's got to be rowing, everybody. And if you don't know how to, then the as a whole is screwed. But if you do want to learn some of these skills, you can join like a bigger company that has it's like I was going to say Titanic. That's probably not, it's like an ocean liner that's already going. And so you can get this training in some of these bigger institutions. And then I guess you can transfer to an entrepreneurial like startup, which is like 5 people. And what do you think about that? Is that kind of the better way to do it, is learn skills in a big place and then go to a small place?
Great question. And I'll speak to it on a few fronts. So there's a classical model, of course, start your career and go to a big company and then pursue your entrepreneurial dreams once you've have your career on the rails, and then go be entrepreneurial when you have the opportunity to take a little bit more risk. That's one way. Have I seen people who had those ambitions and then got handcuffed to the corporate life and couldn't get out and spent too much time in corporate to the point where when they look behind in the rearview mirror on their resume, they were so corporate that entrepreneurs or startups were afraid to take a chance on them because they couldn't break those processes and shields and everything that they learned in that big corporate environment? The answer is yes. On the flip side, there's been people who I've known who got a chance to join a startup right out of the gate, right out of their bachelor's program, right out of their master's program, right out of academia, whatever it may be. And they don't know anything else except startups. And I think going the startup way then into corporate is significantly more challenging if you like the startup environment mentally, emotionally, spiritually, rather than going corporate into the startup world. Once again, people who have gone from corporate thinking that they want to be in the startups often, I shouldn't say often, sometimes find out that it really isn't for them, but then they have the opportunity to go back. There isn't a right way. What I would say is if you aren't sure of what you want to do out of the gate, and there isn't this entrepreneurial startup opportunity knocking on your door, waiting for you to jump right in with somewhat of ease, going to a large organization to start your career, to learn about the resources, to be professional, learn how to build relationships, understand processes, get the fundamentals. And then if you've maintained this little itch in the back of your head about wanting to always go into a startup company and leverage the experience and the maturation that you've had throughout your career to do, go for it, for sure. Just realize that there is a stigma. If you're 10, 15, 20 years in corporate and you've never left, and you want to go join a startup, I'm not saying it's impossible, but you start putting yourself into a box and breaking those shackles of corporate life, going into a bootstrapped, incredibly lean startup mentality, hair on fire, no resources, figure it out yourself when you're used to the company car, 9 to 5, expense reports, company credit card, 4 different people on your team to be able to do all the micro stuff for you that you have to do if you're in a startup by yourself. You have to think about those things. So it's a personal choice. Sometimes it's a beta. I have had amazing passion stories of people leaving corporate to finally join that startup and they're never looking back. I've had the stories of people jumping out of corporate into startup companies, and the startup companies unfortunately blew up and they have this taste or bad taste left in their mouth and they're never going back to a startup because that's their one-off experience. I don't necessarily agree with that because it's one data point. And if you think that you're an entrepreneur internally, you might want to give it a second shot. Startups aren't easy, no doubt about that, but neither are corporate in a different way, right? The bureaucracy, the red tape, the protecting of your own self in the midst of having all these different people around you. You don't know who's angling who. It's corporate life versus startup life. It's 2 very different things, but eventually, I think my best piece of advice is if you're even considering a startup and you join a corporate or you find yourself in a corporate and then going to a startup, always try to get both and then make the decision.
Okay. Yeah, that's really interesting. I think that's a very good explanation. So let's move to the other side. Let's move to the other perspective. If you are an entrepreneur, if you are a company hiring people, what are some tips to hire the right people and make sure that, somebody's going to produce and they're not going to be a drain of resources, money, time, effort, everything like this? And what should entrepreneurs or what should companies be looking for?
So working for a smaller firm myself, having been there for a long time and seeing the company grow, and I've had a strong level of appreciation of working on very small teams and then seeing a company grow. And then also my relationships that I've had for years of watching founders find their co-founders and having 2, 3, 4-man teams. And then earlier in my career, when I would hear and look at a startup, if you're expanding and you're bringing on number 4 or number 5, like, why aren't you calling me? I would love to find that person for you. And you hear these stories of, I have my network and I'm going to, call these people and see if they work out, or someone else on my team, if they know of anyone who they would want to work with. And I think all these years later, and I think it's like life, everything comes with time, and which leads to wisdom. And then you understand a little bit more about a little bit more. I have a much stronger appreciation for 10 people or less teams. And that number can fluctuate, but just for the purpose of this point, working with people who you absolutely trust, who may not be the PhD in neuroscience that's right down the middle that's going to solve your technical problem. And having that person on your 4-man team technically might solve something more efficiently or faster. But if you don't know who that person is, if you don't know how they work, if you're a bootstrap startup company and you don't know if that person's going to work out, and is it going to be a burn on your capital, and who knows what their angle is 6 months later. That's why I understand why people say, listen, I'm going to reach out to my network. I'm going to see if there's people who I trust. I'm not going to hire a recruiter right now. If for some reason it becomes a pain point and we have tapped out of our network and we have to bring an outsider in and run through a very thorough process, then let's do that. I have a much stronger appreciation for that. When you start getting that 20-person over style company, and for every person that you add on, the impact gets a little bit less and a little bit less. And if you think about it, if there's 10 people in a company, each person represents 10% of the company. That's a lot. When you get into 20 people, each person represents 5% of the company, right? When you get to 50 people, 2%. When you get to 100 people, 1%. And not to dilute the individual, right? There's a lot of different impact, but there gets to a point of growth where you can afford to bring out outsiders who bring in very specific talent that will augment your purpose and your mission of the technology that you're developing in a much more efficient manner. Once again, not to say that you can't recruit before that 10-person startup company, and I have done that numerous times. I'm just saying, if a startup's listening to this right now and you have an appreciation and going back to our earlier points, have been a networker throughout your career, and you trust people who can help get your startup company off the ground, always pull on your network, always pull on that trust factor, because people go to work for people. That's what they do, especially in startups, and especially really early stage startups. Of course, the technology matters, the mission matters, the story matters. But if I don't like somebody, but the story's great in terms of the technology, why would I show up there every single day? Like, I know who that person is. Why would I give my time? I have limited time on this earth. So why would I give my time to go join that company knowing that, yeah, the technology sounds sexy, but why am I going to go work for that person? People go to work for people. And so if you can mitigate that by not spending a bunch of money, not diluting yourself, and you have some trusted people who you know, who you've built your network with throughout your career, always pull that string first. And then after that, go to an amazing recruitment firm like us, who's going to run a thorough process, ask all the right questions, push back on you as a client, not just nod my head and say, yes, I'm following your lead, but take our counsel. That's the reason why we exist. And then we find the right candidate together.
Yeah, definitely. I guess the takeaway for me is that if you're you need to have somebody that you trust. If you're a 5-person team, that's 20% of the company, or 10% of the company is like a really bad person can really sink the whole company. But you should almost get somebody who's not necessarily mediocre, but like somebody you trust, but potentially mediocre, rather than a superstar that could have other intentions or something like this and could really sink you. But yeah, so Giovanni, this has been really good. You are also actually an expert on raising venture capital, raising money. I think we should talk on another episode for this because I want to respect your time. But this has been really interesting. Is there anything that we didn't talk about that you wanted to mention? Do you want to talk about your podcast as well?
Glad to talk about the podcast, and it might be a nice segue into part 2 of this, which more than glad to talk about raising capital. And it might actually be cool to do it on a second one too, so we can elaborate a little bit more. Yes. So thank you for bringing it up. I am conducting and hosting a podcast called MedTech Money, which is hosted on Spotify as well as Apple. And it's powered by Project MedTech. So shout out to Dwayne Mancini, who has sponsored me to be able to host this amazing podcast series, which fundamentally is bringing entrepreneurs who are raising capital or have raised capital, as well as investors who invest in medtech together. And when I say together, they are one-off interviews and they are one-off podcasts, but the collective whole of the series is really where the magic comes in. And so I've got this little pitch down to a science at this point. The way I like to paint an image of it is, imagine 3 columns. You have 1 entrepreneurs, 1 investors, and the third is third-party support systems, accelerators, attorneys, investment bankers. So what I wanted to get together was the whole collective of people involved in raising and investing within medtech startups. And I wanted to demystify that because I work so often with early stage startups and early stage founders and first-time CEOs who honestly have no clue on how to raise capital. And they have to start from somewhere. More often than not, going back to the whole networking thing, pulling on your network is always the greatest resource to start asking questions. So always be good at asking questions. However, this is different than books that you can raise on venture capital or raising money, et cetera. One book that I do recommend for all those listeners out there is called The Secrets of Sand Hill Road by Scott Cooper. If you can read that, it's a great book on understanding how to raise venture capital, and it's applicable to all industries, not just the medtech one. But anyway, this is going from entrepreneurs who have founded companies, raised seed rounds, Series A, Series B, Series C, crossover rounds, SPACs, gone IPO. And then on the flip side with entrepreneurs, it's high net worth individuals, family offices, angel groups, micro VCs, early stage VCs, traditional VCs who invest in Series A, and then down the line, and then going all the way to private equity, and then even corporate division investors to get their perspective. And then the third, once again, is investment bankers, how to use them, when to use them, why to use them. Attorneys, how to use them, when to use them, why to use them during capital raises. Accelerators, what do accelerators do for startups to be able to get them off the ground to then be able to be, quote unquote, investable. So what I want to do with this numerous podcast series, I have high ambitions for how many podcasts I will be doing within the series, is to actually create this holistic view of how to raise capital in medtech and to demystify that whole process, which often is quite mystified within the industry.
Very cool. Yeah, I think it's awesome. I'm glad that you're doing it. And you, as we were talking about before we started recording, you were doing the same thing on Clubhouse before, but that's very ephemeral. You lose that, but this is a good way to diffuse that and make sure that people can listen to that on their own time. But Giovanni, this has been excellent. Again, I want to respect your time. I can't wait to have you on again. And as always, it's good to talk. So thanks for coming on.
Thank you very much for having me.
Hope you enjoyed the show and were able to learn something new, bringing together different fields in novel ways. Until next time on the Neural Implant Podcast.